Come on up.
Am I on the floor? Am I on?
Sure.
Okay. Mine is two parts. One is I read a book that said a man cured his AS by his diet, and he eliminated all the starch, all the lactose, and all the sugar, which is the flour, corn, breads, pastas, fruits, veggies, beans, everything imaginable that you can eat. And I tried it kind of and didn't have a whole lot of success. Is there any data on that, or is somebody just making a few extra bucks? I mean, it's a healthy diet, I'm sure, but...
Diet therapies have taken hold because of the fact that our other therapies don't always work. And they become popular. When they're studied in a rigorous way, they don't show an impact. I mean, and it's hard to study diets. It's hard to control for it. Mm-hmm. Because people know what they're doing, and you have to study in a more rigorous way. Okay. On the other hand, if you change the bowel flora by your diet, it might do something. It's like antibiotic therapy, for instance, for rheumatoid arthritis or ankylosing spondylitis. There's a whole movement to use, the minocyclines and tetracyclines and things like that, antibiotic therapy. The problem is that antibiotic therapy certain antibiotics actually have a mild anti-inflammatory effect, somewhat to the level of a Motrin. So if you study antibiotics like minocycline in large controlled trials, hundreds, maybe thousands of patients, you can show a statistically significant difference because the antibiotic has an anti-inflammatory effect. If you took the same group of patients and studied Motrin, you'd show the same effect. So it's not clinically important effect, but it's statistically significant. So diets and antibiotics and some of these therapies, there's a popularization of them, okay? But they don't. I have to sit down for a second. I've been up for a long period of time, so my back goes. I have 2 hours on my back, and then I'm done. The antibiotics and others, they have a mild non-specific effect, okay? And that mild non-specific effect will show up in a clinical study. So that kind of answers your question. When you subject these things rigorous proof, they fall out.